I'm Juanita Mackay. I'm a single parent with a number of children of my own, fostered, adopted and biological, and I head up Gezubuso Projects in Pietermaritzburg. Gezubuso Projects was established in January 2004 by a group of people, men and women, who saw a desperate need for educating others in HIV and AIDS and the allied subjects. We then decided that we were going to look after orphaned and vulnerable children, and we established the Sunshine House Project, where we foster children and we care for them. We also have our training programs, and then we grew to doing the gardening and doing the Keep Safe programs. The problems are great. Instead of the numbers going down, in some areas they have gone up, and in some areas they've remained the same. The high percentage of children and babies born with HIV and AIDS is still very frightening. Many of the mothers are teenagers, so it looks as though no matter how much education is given, it's not being listened to, it's not being heard by the teenagers. We're not sure why, we're not sure whether it's due to peer pressure or poverty or ignorance, and that is what is very worrying. Pregnant mothers are now being given the opportunity to have HIV-free babies if they go to the clinics and the hospitals in time. But again, many are not taking advantage of this for various reasons. Also a lot because of poverty, because they don't go for antenatal examinations to the hospitals because they don't have the money for the bus fees and the taxi fees. We have a number of things that we try to do. We do not know how successful they are, but we think in some cases they're very successful. We run training programs in our training centre on HIV and AIDS, on sexually transmitted diseases, advising people to go for voluntary counselling and testing. We also run programs on caring for those who are terminally ill, home-based care programs. We do HIV and AIDS counselling training. We do ARV literacy training. And then we go out into the rural areas when funds allow to do the same training and try and reach the people who don't have access to these resources. We try to go into the schools and the high schools and teach the young people about the dangers and the risks that they're taking, and that is from that we developed the Keep Safe program. The Keep Safe program came about from the Youth Development Program. The Youth Development Program is aimed at teenagers, teaching them about the options they have and respect and values and decision making, that they make the correct decisions to keep themselves safe and not to ruin their lives by becoming school dropouts or teen mothers. While we were doing these programs in the various schools and communities, we realized that there are no programs aimed at primary school children, and the high rate of sexual abuse for primary school children, as young as 3 years of age, some of the children, was of great concern to us. So we developed the Keep Safe program, where we go into the schools and we run 45-minute sessions with the classes, using colouring in books, crayons, journals, magazines, any material that we can use with the children to make them aware of themselves, of respect for themselves and for others, and allowing them, by empowering them to go with this knowledge, to be able to report abuse that is taking place at home or in their community, and showing them who they can access for help. Our focus on children and youth is because so many are dying unnecessarily. So many children are brought into the world already with a death sentence over their heads. So many are lucky enough not to be born HIV positive, but still have to go through the trauma of abuse of various forms. And those who do survive primary school and early childhood are going into high school and perpetrating exactly the same actions and deeds that cause the young ones to suffer. So we're trying to make life a little bit easier by imparting knowledge and skills so that these youngsters can actually reach their full potential as responsible adults and live dignified, happy, productive lives.